Have you ever left a doctor's appointment feeling relieved because your tests came back normal? Most people do. But what if I told you that some medical tests, especially after 70, can lead to surgeries, complications, anxiety, and even life-threatening conditions? It sounds unbelievable, but modern medical research is beginning to reveal a hidden problem that very few seniors know about. It's called over-medicalization. Studies published in the Journal of the American Medical Association suggest as many as 30 to 40% of tests for seniors provide little benefit. In fact, some of these tests can trigger what doctors call a medical cascade. A small finding leads to a chain reaction of procedures. Suddenly, a person who felt completely fine is dealing with side effects, hospital visits, and treatments they may never have needed in the first place. Many seniors undergo these tests every single year, believing they are protecting their health. But sometimes, the thing meant to protect you can harm you. Today, we're going to reveal 5 health checkups that many experts now say seniors over 70 should think twice about before doing. These aren't strange or rare procedures. They are common tests that millions of people receive every year. Research shows they can trigger unnecessary surgeries, cause dangerous complications, expose the body to radiation, or lead to medications with serious side effects. One test is so controversial that experts estimate it may contribute to 5% of cancer cases in the United States due to repeated radiation exposure. Many people requesting these tests feel perfectly healthy before getting them. But once the process begins, it can be difficult to stop. We're going to walk through 5 medical checkups that may do more harm than good after age 70, based on real research and expert recommendations. Make sure you stay until the end, because the number one test is one that private clinics heavily promote despite warnings from major medical organizations. Before we dive in, we'd love to hear from you. Tell us in the comments, where are you watching from and how old are you? Have you ever had a medical test that caused more stress than expected? Your experiences help others in this community make better health decisions. If you enjoy learning about senior health and longevity, make sure to like and subscribe for weekly research-based insights. Now, let's begin with number 5. A test that seems completely harmless. It's quick, painless, and many doctors recommend it automatically. But for many over 70, this test may create fear and medication side effects, even when there is little real danger. Number 5. Bone density scans, DEXA scans. At first glance, a bone density scan seems like one of the safest medical tests imaginable. There are no needles, no sedation, no surgery. You simply lie on a table while a scanner measures the density of your bones. The test, officially known as a DEXA scan, is commonly used to diagnose osteoporosis, a condition where bones become fragile and more likely to break. Doctors often recommend this test to older adults, especially women, because bone density naturally decreases with age, and preventing fractures is extremely important. But here's where things get complicated. After the age of 70, bone density loss is almost universal. Just like grey hair or wrinkles, it is part of the natural aging process. That means a large percentage of people over 70 who undergo a DEXA scan will receive results showing osteopenia. But osteopenia does not necessarily mean someone will suffer fractures. In fact, many seniors with osteopenia live their entire lives without ever breaking a bone. Yet once this label appears in a medical record, it often leads to a prescription for medications called bisphosphonates. These drugs include medications like alendronate, risdronate, and ibandronate. They are designed to slow bone loss, but these medications are far from harmless. Research shows long-term use can lead to several serious side effects. These may include severe digestive irritation, esophageal inflammation, or even unusual thigh bone fractures, and a rare but frightening condition known as osteonecrosis of the jaw, where portions of the jawbone begin to deteriorate. Some studies suggest for many adults over 70 with mild bone loss, these medications may reduce fracture risk by less than 1%. To understand how this plays out in real life, consider the story of Eleanor, a 74-year-old retired schoolteacher. Eleanor had always been active. She enjoyed gardening, walking with friends, and taking dance classes at her community center. During a routine checkup, her doctor recommended a bone density scan just to be safe. The scan showed mild osteopenia. Even though she had never broken a bone, She was started on a bisphosphonate medication. Within a few months, Eleanor began experiencing severe acid reflux and difficulty swallowing. Eventually, the symptoms became so uncomfortable that she stopped going to her dance classes and social gatherings. When she later saw a specialist, they reviewed her case and realized her fracture risk was already extremely low. In other words, the medication may never have been necessary. After focusing on lifestyle measures like strength training and balance exercises, Eleanor gradually returned to her normal routine. Stories like this are more common than many people realize. Research shows exercise programs focused on strength and balance can reduce fall risk by more than 20 to 30%. Simple habits such as resistance training, daily walking, and adequate protein intake have all been shown to protect bone health. In many cases, these strategies provide greater long-term benefits than medication alone. Now, this doesn't mean bone density scans are always useless. For people with previous fractures, they can be extremely helpful. But for many healthy adults over 70, the scan may simply reveal normal age-related bone loss that triggers unnecessary treatment. And sometimes, the treatments cause more problems than the test was meant to prevent. But surprisingly, the next test on our list can create even more anxiety because it involves memory loss. And once this test begins, it can lead to a chain of follow-up procedures that many people never expected. Let's talk about that next. Number 4. Brain MRI for mild memory loss. Few things worry people more as they grow older than the thought of losing their memory. For many seniors, the moment they begin forgetting names or misplacing their keys, a frightening question appears. Is this the beginning of dementia? Because of that fear, many doctors respond by ordering a brain MRI. An MRI is a powerful technology that creates detailed images of the brain's structure. It can detect tumors, bleeding, and strokes. But when it comes to mild forgetfulness in adults over 70, research shows that MRIs often create more confusion than clarity. As the brain ages, it naturally undergoes subtle structural changes. Small areas called white matter lesions often appear. These findings sound alarming, but in reality, they are extremely common in healthy older adults. Nearly 90% of adults over 70 show some form of abnormality on brain MRI, even with perfectly normal cognitive function. The problem is not the scan itself, but how the findings are interpreted. This can lead to what specialists call the diagnostic cascade. First, the MRI, then a neurologist referral, and perhaps additional tests. A 2021 review found that while 86% of scans showed abnormalities, only 3% actually revealed a condition requiring medical treatment. Let's look at Robert, a 73-year-old retired accountant. He noticed small memory lapses, like forgetting where he placed his glasses. His MRI report mentioned microvascular disease. The phrase alone terrified him. Robert became convinced he was developing dementia. He stopped volunteering and withdrew from social activities, fearing his mental decline would soon accelerate. But when he saw a neurologist, the doctor explained that those MRI findings were completely typical for someone in their 70s. Robert then completed a standard cognitive screening test. His score was well within the normal range. The problem wasn't dementia, it was fear triggered by misunderstood imaging results. After staying socially engaged, Robert reported that his memory actually improved over the following months. Geriatric specialists recommend cognitive screening tests rather than brain imaging for mild forgetfulness. They provide a much clearer picture. MRIs are usually only recommended for warning signs like sudden personality changes, seizures, or rapid decline. The next test on our list may be even more common, leading to procedures that carry significant risks. Number 3. Cardiac stress tests. The heart is often the biggest concern as people age. After all, cardiovascular disease remains one of the leading causes of death worldwide. So when a senior mentions feeling slightly more tired than usual or experiencing occasional chest discomfort, doctors often recommend a cardiac stress test. The test is designed to evaluate how well the heart functions during physical exertion. Typically, the patient walks on a treadmill while doctors monitor the heart using an electrocardiogram. If the patient cannot exercise, medications may be used to simulate the effects of exercise on the heart. The goal is to detect reduced blood flow to the heart muscle, which could indicate blocked arteries. When someone has clear symptoms of heart disease, such as chest pain or shortness of breath, stress testing can be extremely useful. But when used as a routine screening tool in adults over 70 without clear symptoms, the test becomes much more controversial. One of the biggest issues is something called a false positive result. This occurs when the test suggests there may be a blockage in the arteries, even though the arteries are actually healthy. And unfortunately, false positives are very common in older adults. According to research, the false positive rate for stress tests in adults over 70 can reach 30 to 40%. That means nearly 1 out of every 3 abnormal results may not represent real disease. But once an abnormal result appears, doctors often feel obligated to investigate further. This typically leads to coronary angiography, an invasive procedure where a catheter is inserted into the arteries. And if even a mild narrowing is detected, a stent may be placed. But here's where things become surprising. Large clinical trials have shown that many stents in stable patients do not significantly reduce heart attack risk. The landmark ischemia trial found that invasive procedures provided no major survival advantage over non-invasive treatment in many cases. Yet those procedures still carry risks. Complications include bleeding, kidney injury from dye, and irregular heart rhythms. And for older adults with other health conditions, these risks can be even higher. Consider the experience of Daniel, a 76-year-old retired mail carrier. Daniel stayed active and walked nearly 2 miles every morning. During a routine checkup, he mentioned that climbing steep hills sometimes made him feel tired. His doctor ordered a stress test to be cautious. The results came back borderline abnormal. That single phrase set off a chain reaction. Daniel was referred for a coronary angiogram. During the procedure, doctors found a mild narrowing and decided to place a stent. But after the procedure, Daniel experienced a severe reaction to the contrast dye used during the test. His kidneys temporarily stopped functioning properly, and he required hospitalization for nearly a week. Months later, his cardiologist admitted something surprising. The narrowing in his artery was unlikely to have caused serious problems, and Daniel's fatigue. It was later attributed to dehydration and mild anemia, not heart disease. This doesn't mean stress tests should never be performed. For patients with chest pain, shortness of breath, or fainting, it can be life-saving. But when used routinely in stable seniors, the test may lead to procedures that were never truly necessary. And the next checkup on our list is even more surprising. Many consider it one of the most important cancer screening tests. But after a certain age, the balance begins to shift dramatically. And that brings us to number 2. Number 2. Colonoscopy after 70. Few medical tests have saved as many lives as the colonoscopy. For decades, doctors have relied on this procedure to detect colon cancer early and remove precancerous polyps before they become dangerous. And for adults in their 50s and 60s, this screening has been incredibly effective. But something important changes as we get older. After the age of 70, and especially after 75, the balance between benefit and risk begins to shift. A colonoscopy is not a simple test. It requires preparation that many people underestimate. Before the procedure, patients must drink strong laxative solutions designed to completely empty the colon. These preparations can cause severe dehydration, electrolyte imbalances, dizziness, and weakness, especially in older adults whose bodies are more sensitive to fluid loss. For some seniors, the preparation alone can lead to dangerous drops in blood pressure or kidney stress. But the risks don't stop there. During the procedure, patients are usually given sedation medications. While these drugs are generally safe, older adults metabolize them more slowly, which increases the risk of confusion, breathing complications, and irregular heart rhythms. Then there are the mechanical risks of the procedure itself. Although rare, colonoscopies can cause bleeding, infection, tearing of the intestinal wall, or complications related to anesthesia. And when perforation occurs, it can require emergency surgery and extended hospitalization. Now consider something even more surprising. According to a large study published in JAMA Internal Medicine, researchers analyzed more than 1.3 million Medicare patients aged 70 and older who underwent colonoscopy screening. Their findings revealed a troubling pattern. For patients over 75, Serious complications occurred far more often than life-saving cancer detections. In fact, for every 1,000 colonoscopies performed in adults over 75, only about 2 lives were saved from colon cancer, while more than 20 patients experienced significant complications. That's roughly a 10-to-1 risk-to-benefit ratio. In other words, many older adults faced medical harm without receiving meaningful benefit from the test. Why does this happen? Because colon cancer typically develops very slowly. Many polyps take 10 to 15 years to transform into cancer. So if a healthy 55-year-old removes a precancerous polyp, it may prevent cancer years down the road. But if a person is already in their mid-70s or 80s, that same slow-growing polyp might never cause problems during their lifetime. Removing it may expose them to procedure risks without improving their long-term health. Let's look at an example. Margaret, a 72-year-old grandmother, ran a small family bakery with her daughter. She had no symptoms, no bleeding, no digestive problems, and she had already undergone 2 normal colonoscopies earlier in life. But during a routine visit with a new doctor, she was advised to repeat the test just to be safe. Margaret trusted the recommendation. During the colonoscopy, the doctor found a very small polyp and removed it. The procedure appeared successful, but later that evening, Margaret began experiencing severe abdominal pain and dizziness. Her family rushed her to the emergency room, where doctors discovered a bowel perforation, a small tear in the intestinal wall. She required emergency surgery and spent over a week in the hospital recovering. Ironically, the polyp that triggered the complication turned out to be completely benign. Margaret eventually recovered, but the experience left her weaker for months and forced her to temporarily close the bakery she loved running. Stories like this are the reason many health organizations have revised their screening recommendations. Today, the U.S. Preventive Services Task Force generally recommends stopping routine colon cancer screening around age 75 for people previously screened. For those between 70 and 75, the decision is often individualized based on overall health, previous screening results, and life expectancy. And for seniors who still want some level of screening, there are safer alternatives. One of the most widely recommended options is the FIT test, short for fecal immunochemical test. This is a simple, non-invasive test performed at home that checks for microscopic blood in the stool, an early warning sign. The test requires no sedation, no laxatives, and no invasive instruments, and when performed regularly, it can still detect many concerning cases early enough for treatment. Of course, colonoscopy remains extremely valuable in specific situations. If someone has persistent blood in the stool or unexplained anemia, then the benefits of the procedure may still outweigh the risks. But for many healthy seniors, repeating colonoscopies late in life may expose them to harm. And now we come to the final checkup on our list. The one that many private clinics promote as the ultimate preventive health scan. Some facilities market it as a way to detect cancer before symptoms ever appear. Others call it a total body screening. It sounds reassuring, it sounds proactive, but according to many medical experts, it may actually be one of the most overused scans, and the reason why may surprise you. Because the danger doesn't come from what the scan finds, it comes from the radiation it exposes the body to, and the chain reaction of tests that often follows. Let's take a closer look at number 1. Number 1. Full-body CT scans. Now we arrive at the most controversial checkup on our list. A test that many clinics advertise as the ultimate tool for early disease detection. You may have seen the ads before. Detect cancer before symptoms appear. Scan your entire body in minutes. Peace of mind for your health. It sounds incredibly reassuring. After all, who wouldn't want to scan their entire body and catch diseases early? But routine full-body CT scans may create more problems than they solve. To understand why, we first need to understand what a CT scan actually does. It uses powerful X-ray technology to create detailed cross-sectional images. These scans are extremely valuable when doctors need to investigate specific symptoms such as internal bleeding, tumors, or serious injuries. But when CT scans are used to examine the entire body of someone who has no symptoms, the situation becomes much more complicated. The first issue is radiation exposure. CT scans use ionizing radiation, which has enough energy to damage DNA inside cells. A single, full-body CT scan can expose the body to between 10 and 20 millisieverts of radiation. That is roughly several hundred chest X-rays combined. Even for older adults, repeated exposure can still increase cancer risk. A study in JAMA Internal Medicine estimated CT scans could account for 5% of cases. It means that some cancers may actually be caused by the very scans intended to detect disease. But radiation isn't the only concern. The second major problem is incidental findings. A CT scan often detects small abnormalities that are completely harmless, like tiny lung nodules or harmless cysts. Most of these findings are completely normal parts of aging. But once they appear on a scan report, they are often impossible to ignore. Doctors may feel obligated to investigate further. Patients understandably become anxious. Suddenly, a healthy person is caught in a cycle of follow-up tests. This phenomenon is known as the cascade effect. One test leads to another, then another, and sometimes the complications cause far more harm. Consider the story of Victor, an energetic 79-year-old former martial arts instructor. Victor prided himself on staying active and rarely visited doctors. But one day he saw an advertisement for a private clinic offering a full-body CT scan package, promising complete peace of mind. Curious and wanting to stay proactive, Victor scheduled the scan. The results showed something small, a 3-millimeter nodule in his lung. The radiologist noted it was likely benign, but recommended additional testing. Victor was referred for a PET scan, then a needle biopsy. During the biopsy, a complication occurred. Part of his lung collapsed. Victor was hospitalized and required a chest tube. After weeks of recovery, the final pathology report arrived. The nodule was completely benign. The entire chain of events was triggered by a tiny abnormality. This is why medical organizations like the American College of Radiology discourage routine full-body CT screening for healthy individuals. That doesn't mean CT scans are dangerous when used appropriately. They save lives for severe injuries, suspected bleeding, or unexplained symptoms. But using them as a blanket screening tool for the entire body is like searching for a needle in a haystack with a bulldozer. Modern medicine is one of humanity's greatest achievements. But medicine is most powerful when it is used wisely and selectively. For adults over 70, the goal shifts toward protecting quality of life and independence. Focus on habits that truly matter. Stay physically active, maintain social connections, and work with a trusted doctor who understands your personal health goals. Share your experience in the comments below. Your story might help someone else make a smarter decision about their health. Because growing older doesn't have to mean becoming weaker. With the right decisions, your healthiest years may still be ahead of you.